So this is the clinical situation. This patient has presented to you with this situation. Look at this condition and what you can notice over here. What you can notice over here, you have a slight midline off, and one of the reason for the orthodontic treatment is to have the best of the aesthetics. And this patient is not happy and satisfied with the aesthetics, with the details of this. So now we all have also discussed in the previous classes what do we understand by the micro aesthetics, and the component of the micro aesthetics are the white and the pink aesthetics. We are talked about the height to width ratio of the tooth, single tooth. We talk about the height to width ratio of one tooth with the adjacent tooth. There is a golden proportion. One tooth has some ratio with the other tooth. So here the discrepancy is not only the size of the tooth but also with the opposing arch, because the midlines are off and you are having a slight overjet. And patient is slightly not happy, that the patient is not very happy with the ideal condition. We are going to unfold this clinical scenario and situation. Why actually this happened? This micro details of unhappy patient is because of the mismatch of the size of the teeth between the upper arch and the lower arch. The mismatch in the sizes of the teeth between the upper arch and the lower arch is discussed in full detail in the Bolton discrepancy. So now we all know about the Bolton discrepancy, we know the basics of the Bolton. Now in order to maximize the best of the aesthetics, we all know about what are the components of the microaesthetics. We know about the proportion of a tooth, we know about the golden proportion, the height to width ratio of one tooth with the adjacent tooth. So now what we have to do in order to match the midlines and in order to maximize the aesthetic, this is the topic of today. What is a Bolton? Bolton analysis is all about what is the status of ratio between the upper and lower teeth, and with this formula we come to know that is there any discrepancy in the upper arch and the lower arch, is the sizes and the mass of the tooth is greater in the one arch or in the other arch, okay? And what we can do for correction of this discrepancy, this I will discuss today. So how we do Bolton discrepancy? The Bolton discrepancy is divided into two parts, anterior and posterior. Anterior means we are concerned from canine to canine, and all of the dentition means that the 12 teeth from 6 to 6 teeth are measured in the Bolton discrepancy of the whole dentition. Why this is so important? Why the Bolton discrepancy is so important in the anterior zone? Because if you have this discrepancy in the anterior zone, your midline would not be matching. You would be having slight overjet, slight overbite, slight crowding of the teeth, and your aesthetics, microaesthetic may be compromised. Okay? But if you have this discrepancy in the posterior teeth, you would be having the issue of cusp to fossa relationship. For the ideal situation, one cusp of a tooth must be sitting in between the teeth, either buccally, or should be sitting either buccally in the embryo space or should be sitting in the central fossa of the teeth. Only then you would not be having the possibility in the atrium. Just imagine a situation if the one cusp is hindering with the opposing cusp. What would happen? This keep on touching, there's a possibility of atrium leading to sensitivity. There is a possibility of lack of proper protrusive or lateral movement of the mandible. Because of the hindrance of these cusps, they will be interfering. So that's why in order to have the situation something like this, the cusp and the opposing cusp in the other arch. One cusp is sitting in the embryo space or in the central fossa. In order to have this condition in the posterior segment, you have to have the situation that upper cusp is sitting into the posterior dentition in a way that if there is mismatch of the sizes. Just imagine a situation. Ideally it has to be like this. This is kind of an sorry, pardon for my poor drawing. This is the situation. Just imagine the tooth anterior to this point. This is smaller in size. If this is smaller in size, then what will happen? This may migrate more easily. This may migrate more easily, and you would be having this cusp coming to this position. And you will be having commencement of interference.
Recording in progress.
Okay, and you would be having the issue of the interference of the cuspal tissue if this tooth is smaller in size. In a similar situation, if this particular tooth has discrepancy and is larger in size, then this would start interfering. So the crux of the situation is this, that you have to have the ideal proportions of the sizes between the upper and the lower jaw, especially in the posterior segment, to have the proper cusp to fossa relationship, and for the anterior segment to have the optimum overjet, overbite, midline, and especially overjet. Because if you have the increased mass of the tooth, what the common sense is, if you're having the greater mass of the tooth in the maxilla, you would be having greater overjet. This is a common sense. So here is the equation that is in front of you, that, and how to memorize it. You have the upper jaw, maxilla in the upper, mandible in the lower. Just reverse the situation. Here the mandible is up, maxilla is down. Sum of mandibular, 12. In our jaw, you see maxilla up, mandible down. Reverse the condition. Mandible up, mandibular 12 teeth up, maxillary 12 teeth down, divided by 100. For the best of the aesthetics, this ratio, ideally this is the size of individual teeth is measured by the digital vernier caliper. We talked about it in the previous lectures. So the sizes of the individual teeth are measured and they're summed together, and the sum should be around 91.3%. It's mean to say that the sizes of the mandibular teeth, the major distal width of 12 mandibular teeth are 91.3% of the maxillary teeth. The major distal width of the sum of the 12 mandibular teeth are 91.3% of the maxillary 12 teeth. This ratio tells us this. So it's my message so far is this, that as you are comparing between the size of the upper and lower teeth, so you have to have a reference of normality. Then with the reference of the normality, you can be able to define as Bolton discrepancy or as Bolton excess in the opposing arch. Okay, if you consider that the mandibular size is normal, only then you can define and label the maxillary teeth as maxillary deficiency or excess. Moving on, how do we calculate this? The equation is this. From where we started, we want to know what exactly we have to do, how much stripping actually we have to do, how much stripping actually we have to do in order to correct the midline and overjet and to match the Bolton surface. So what actually we want to know? We want to know how much millimeter of buildups or stripping. Stripping means IPR, interproximal reduction, you have to do in order to match the midlines, in order to maximize the microstatic in order to achieve the Crux to force relationship. So this is the thing which we want to know, how much millimeter of the buildup if you have deficiency or if you have excess of interproximal reduction you have to do in order to correct the Bolton discrepancy. So this formula is of the ideal situation. This topic is taught in the final year and suppose is very easy, so that's why I'm going in slightly more faster. So now what we have to do? What we have to do, that looking at this equation, first of all, we actually have measured the size of the maxillary 12 teeth. Let's say, just for the example, the size is like 80 millimeter. Just for the sake of, this is the actual size or mesodistal width. Let's say this is for, so having this formula, we want to know, in order to have, having this formula, we can know that what should be the ideal mesodistal width of maxillary 12 teeth. Okay? Having this formula, this is actually we want to know. So having the mathematical equation, we can switch it like this: mandibular 12 divided by 91.3 multiplied by 100, and this is simply, we switch this value over here and switch over here. So this is the ideal mesodistal width of the maxillary 12 teeth. This is the ideal. So by using this formula, we come to know what should be the ideal mesodistal width in order to have the corrected Bolton discrepancy. So this is the actual, let's say our value is 83 millimeter. So this is the actual and ideal mesodistal width, let's say 83. So now we come to know that 3 millimeter is the Bolton discrepancy. I am using the word Bolton discrepancy because excess or deficiency is relative to the other arch. Have I made this point clear, Anfal? Have I made this point clear to you? Because excess and deficiency is a relative term to the other arch. Actually, we have done with this formula available with this maxillary 12. With this formula, we come to know that it is the ideal is 91.3. So with this, we come to know that actually we have to use this. We know the actual, we know the ideal. From the actual to ideal, you get the Bolton discrepancy, and positive and negative depend upon the other arch. For example, you have peg laterals, and you assumed the situation that you label and you thought that upper arch is the ideal, and with reference to this upper arch, you will say that you have mandibular excess in the opposite arch. So in order to maximize the aesthetic, you have to do stripping in the opposite arch in order to match the discrepancy. If you have taken the upper arch ideal having the peg laterals, and vice versa, if you have taken the mandibular teeth as an ideal, then you will say that maxillary arch is having Bolton discrepancy, and you would be doing build-up on the peg laterals in order to optimize the Bolton discrepancy. 77, around 77% in the anterior segment, 91.3 in the upper, in the 12 teeth, because the discrepancy in the sizes of the upper central incisors. Here the upper central incisors are much wider in size as compared to the lower. That's why your anterior Bolton ratio is around 77%, 77.3.2. So what the ratio? The ratio, or we can say it as a percentage, is 77.2. Is, we say we reverse the situation and we have the mandibular 6, maxillary 6 multiplied by 100. Ideally, it should be 77 point. So what we do? We measured the major distal width of the upper teeth. Let's say this is 48. The actual is, let's say if the actual is 48 and you have this formula with you. Now you want to know what should be the ideal major distal width of the maxillary upper 6 in order to have the best ratio. Using this formula, you will flip it like this. Maxillary 6 is mandibular 6 divided by 77.3 multiplied by 100. So whatsoever would be the answer, let's say the answer is 46. Then you will say that the actual is 48 and the ideal is 46. Now you have to do some stripping, let's say 2 mm of stripping over here in order to match the midlines, in order to correct the overjet, overbite into the ideal situation. All those people who are appearing in the MORTH exam or in the exam situation who are looking for the ideal of the aesthetics, you must be, this is an integral part of the diagnosis, because in the finishing stage you could be struggling with many situations that even if your midline is off, I'm showing you cases. That's why I keep this topic on the first for the extraction versus non-extraction. Now moving on to the extraction versus non-extraction situation. This topic I will discuss later on in the end of the treatment. Then I will be telling what kind of the compromises you could have if you are having Bolton discrepancy and how you could be able to manage it. The simple concept is this: you could do stripping or you can do build-up or veneer. Okay. So is this point is clear? What I mean to say, that we take one arch as relative because this is the ratio and we have to check it with the eyeballing. For the quick check is this, that the upper lateral incisor should be wider than the lower incisors. This is a quick check. And the second quick check is this, that upper and lower fives, second premolar, should be of the same sizes, because most of the time you have the hypodontia of lower second premolar is 3%, and most of the time you would be having the discrepancy in the sizes of the fives. So if you have this discrepancy, you could not be having ideal crus to fossa relationship, especially in the posterior segment.